Today, I'm really happy to tell you about inflammatory bowel diseases and associated arthritis conditions and what you can do about them. It's called the radical induction theory, which basically says that if all of our bodies produce oxidative stresses, right? We produce hydrogen peroxide as a primary oxidative stressor for bacteria and viruses and parasites. We're trying to kill them with free radicals. But if we don't also have good mechanisms for quenching those free radicals, you can now inflame the mucosal lining and now allow highly immunogenic fecal bacterial antigens to go through into the submucosa. White blood cells pick up on those, and now you have tons of inflammation and ulcers. The reason that this theory kind of came about is that they have mice called knockout mice, where they basically take out various genes from the mice, and then they see how they do. And if you take mice and you knock out their glutathione peroxidase and catalase, which are your two primary antioxidant mechanisms, they develop colonic ulcers. Okay, biologics. This really, these were a game changer when they came out. This was probably about maybe 20 years ago when they first had Humira, which was the first biologic TNF alpha inhibitor. These really do effectively hamstring the immune system for better or for worse. So how do you evaluate this? Well, I personally, I'm an ND. I can do a lot of lab testing. Having a good history is your kind of cornerstone. You've got to have a great history. But then I like having lab testing so I can dig into these other possibilities. I usually do put someone on some kind of diet. It's surprising that most people are not put on some kind of diet when their gut is super inflamed. And what's the thing that the gut sees most often? It sees food and it sees microbes. We should probably consider those two things. Also, like I said, IV therapy, you're going to bypass the gut. You're not going to depend on the gut for absorbing nutrients. So you can really pump up nutrient status so you can get some more antioxidants, anti-inflammatory substances. You can get glutathione into people. Typically that is depleted in these people. NAD is also fabulous for replenishing people.